Good afternoon, ladies.
Hi.
My name is Tiffany Eleazer. This is my presentation on what is prescription drug abuse for my communications class. According to a study from the National Center on Addiction, Substance Abuse at Columbia University, over 15 million people admit to abusing prescription drugs and pain medication. This number has doubled in adults from 1992 and 2003. It has even tripled among teenagers. One factor behind the growth is that people can get these drugs from doctors, family members, friends, and even through the internet. Prescription drug abuse is the excessive or misuse of prescription and over-the-counter drugs for the purposes other than those in which they are indicated. Drug dependency is the compulsive use of a substance despite the negative consequences which can lead to abuse, addiction, and other serious problems. Analgesics are a class of drugs used to relieve pain. The pain relief is induced by the analgesics that block the pain signals from going to the brain or simply interfering with the brain's interpretation of the pain. There are two types of analgesics, non-narcotics and narcotics. Non-narcotic analgesics are usually the first drugs of choice in treating mild to moderate pain. Non-steroidal anti-inflammatory drugs, or better known as NSAIDs, are a class of medications used to treat mild pain. They have similar properties as acetaminophen, also known as Tylenol, but they both relieve and lower fevers. However, they do differ from the NSAIDs because NSAIDs reduce inflammation. Tylenol is the most widely recommended and used medication for mild pain. There are two types of narcotic analgesics, the opiates and the opioids. Opiates are the alkaloids found in opium, a white liquid extract of unripe seeds of the poppy plant. Opioids are any medications in which bind to the opioid receptors in the central nervous system or gastrointestinal tract. Millions of people take medication for various types of reasons. However, this reliance on medication can turn quickly and without one knowing into a physical dependence. The scary reality is that even though the most commonly prescribed drugs such as Loratabs, Percocets, Vicodin, Loracet, OxyContin, methadone, and Darvocet will offer pain relief, these drugs can cause an individual's body to start relying on the drug in order to feel normal. I will now list for you a few warning signs to watch for if you feel or believe that someone you know has a dependency to a drug. 1. A usage increase. Over time, it is common for individuals taking prescription medications to grow tolerant to the effects of their prescribed dose. If someone you know seems to be increasing his or her dose over time, this is an indication that the amount they were taking is no longer providing relief for them. Change in personality. Change in a person's normal behavior can be a sign of dependency. Shifts in energy, mood, and concentration may occur as everyday responsibilities become secondary to the need for the relief that the prescription provides. Social withdrawal. A person experiencing a dependency may have a problem. A person experiencing a dependency problem may withdraw from family, friends, and other social interaction. Ongoing use. Continued usage after a medical condition has improved will result in the person needing extensions on his or her prescription. The person might talk of how they are still feeling pain and just need a little longer on the medication in order to get well. He or she might also complain frequently about the doctors who refuse to write the prescription for one reason or another. Time spent on obtaining prescriptions. A dependent person will spend large amounts of time driving great distances and visiting multiple doctors to obtain the drug. Watch for the signs that he or she may be preoccupied with the quest for the medication, demonstrating that the drug has become their top priority. Change in daily habits and appearance. Personal hygiene may diminish as a result of a drug addiction. Sleeping and eating habit changes, and a person may have a constant cough, runny nose, and red glazed eyes. They begin to neglect their responsibilities. A dependent person may call in sick to work more often and neglect household chores and bills. Increased sensitivity. Normal sight, sounds, and emotions might become overly stimulating to the person. Hallucinations, although perhaps difficult to monitor, may occur as well. Blackouts and forgetfulness. Another clear indication of dependence is when the person regularly forgets events that have taken place and appears to be suffering blackouts. Defensiveness. When attempting to hide a drug dependency, abusers can become very defensive. If they feel as though their secret is being discovered, they might even react to simple requests or questions by lashing out. Prescriptions to pain medications can be safe when taken according to the doctor's instructions and carefully monitored. However, it is important to recognize that they can also be very dangerous. Remember that the dependency is a disease that can exhibit itself to even the most cautious individual. Therefore, anyone who is prescribed pain medication should take extra precautions to avoid the debilitating effects a dependency can have and watch for the warning signs. Are there any questions?
No.
Thank you very much.